Sorry, everyone. My computer crashed and now it's back. So all's well, hopefully. All right. Are we ready to go? Staff
Ready
side?
to go when you are, Madam Chair.
Awesome. All right. We're going to convene this working session of the Boston City Council. For the record, my name is Kenzie Bach, the District 8 City Councilor. I'm the chair of the Council's Committee on Ways and Means, and this is a working session in that committee today. Forgive me. This working session is being recorded. It's being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. The Council's budget review process will encompass the combination of public hearings and working sessions. And so the hearings are where we hear from departments and we take public testimony. And these working sessions are just for counselors and they're to get our questions out on the table so that departments can get us answers back in writing and at the hearings, and we can make the whole thing more productive. So that's what we're up to today. If you do want to testify, not today, but in future days in the process, you can go find the whole schedule at boston.gov/council-budget. And you can sign up to testify there. You can also go to boston.gov/budget-testify. Or you can shoot us an email at ccc.wm@boston.gov. And we're going to have 2 dedicated public testimony hearings. So May 25th at 6 p.m. focused on BPS, and June 3rd at 6 p.m. on everything else. So if you want to come in an evening and just speak and not wait for a presentation, that's the time. But you can also come at any of the department hearings and speak at the end of those. And you can submit a 2-minute video of your testimony as well. So if you want to do that in advance, we ask for 48 hours in advance, but then we can actually attach it to the end of the hearing so that it plays in the public record. Oh, and you can tweet us your questions and comments at #BOSSBudget, BOS budget. So my long preamble, today's working session is on dockets 0524 to 0526, orders for the FY22 operating budget, including annual appropriations for departmental operations, for the school department, and for other post-employment benefits. Docket 0527 to 0528, orders for capital fund transfer appropriations, and dockets 0529 to 0531, orders for the capital budget, including loan orders and lease purchase agreements. And what we're focused on today are the departments, a whole set of departments that we have hearings coming up for. So those are the Fire Department, Boston Emergency Medical Services, the Public Health Commission, the Office of Health and Human Services. So those 3 will be a trio and a hearing together. The Boston Transportation Department and the Public Works Department, which will also be a duo in a hearing together. And then the Boston Public Schools, our last set of hearings with them, which are on their Commitment 5, Cultivate Trust, and Commitment 6, Activate Partnerships in their strategic plan. So sort of subheadings under that are partnerships, admin, budget, central office, leave of absence, workers' comp, retention, although we talked about that a bit last week, BPS, transportation, school safety, food and nutrition services, and athletics. So it's a lot of that stuff that kind of extends around the school for our students. And I'm joined here today by my colleagues, Councillor Ed Flynn of District 2, Councillor Matt O'Malley of District 6, and Councillor Julia Mejia at large. And I also have some questions that have been sent in by colleagues, but we'll give preference to the folks who are here in person. So that's a bunch of things to get through. So I think what we'll probably do, colleagues, is I'll just start out with questions for, let's do the first half: fire, EMS, Public Health Commission, Office of Health and Human Services. And we'll do a round of those, and then we'll go back and do transportation, Public Works, and BPS, just to kind of split it. And I'll save mine to the end. So I'll jump first to Councillor Flynn, District 2. So Councillor Flynn, questions you want answers to for fire, EMS, the Public Health Commission, Office of Health and Human Services.
Okay, thank you, Councilor Bach. So let me begin with EMS. This is a project that myself and Councilor Flaherty were interested in, but what is the exact status of the EMS Seaport Station? I know I have spoken to EMS, the mayor's office, but it's critical that we have an EMS station in South Boston waterfront, because the times before the pandemic, the response times were going up, unfortunately. So my question is, I know that there is funding for the design and construction of a new EMS station. We're looking for a potential site, but what is the timeline on this? Because my timeline on this is immediately. Engine 3 in the south end is getting funding for design and construction of a new firehouse. Again, what is the timeline? What is the timeline on this as well? Last year, Councilor Block, we had a lot of issues, obviously, with fireworks, but do we have funding this year for outreach and education on the dangers of fireworks? What programs do we have on fire prevention and preventing illegal fireworks? These are quality of life issues, but also important public health and public safety issues. Let's see. What I would like to see in South Boston is more enforcement of non-resident stickers and out-of-state plates. They're having a negative impact on the quality of life for residents, and I want to see a more aggressive BTD approach. I know I'm working with Boston Transportation Department on getting a one-way on F Street in West Broadway. Let me just continue with my notes. Councilor Bork, I was heading into the public health and human services next. Gambling addiction is an issue within the AAPI community. It's an issue within our city and society. But are there any programs within BPHC that addresses gambling addiction in the AAPI community? I know that BPHC may be working with the state's Gaming Commission and Department of Public Health on this issue. And I'd like to see if I'm able to receive an update on it. And I would like to ask public health, especially on gambling issues. I notice a bus on Surface Artery that waits, and it goes directly from Surface Artery in Chinatown to the casino over in Everett. And I believe the casino in Everett is exploiting residents, especially residents of color, the Asian community, but I think they're exploiting them. They're giving them a free ride on a bus and a free lunch to gamble. They're hardworking, their money, they worked hard for, many of them in the restaurants. But I'm not happy with the casino for doing this. I think it's exploiting people, exploiting their weaknesses. And I don't think they especially should be using Boston roads to be giving free rides. So I would like an explanation from public health if we can address this, because this is a concern for me. It looks like there is a possibility that we might need booster shots of vaccines in the fall and winter to continue combating COVID. Are there plans in place now that prepare for that possibility? And how will BPHC coordinate that effort to get everyone to get booster shots, basically? Can we also talk about the renovation project at Woods Mullen Shelter? What upgrades are anticipated and what is the time frame? There are concerning reports. Again, continue with the public health. There are concerning reports, and this is something I've written about and had meetings recently with the health directors at East Boston and South Boston Health Center on increase in HIV infection among persons who inject drugs. What programs or partnerships are there to address this issue and to ensure those living with HIV/AIDS have the resources, the medical care they need? This is a top priority for me. I want to make sure we're as compassionate, as helpful, proactive in helping people living with HIV and AIDS and providing them the medical care and services that they need. But also I want to see, as I mentioned, I also want to see about HIV infections among persons who inject drugs. That is increasing. I want to see what else can we do to be helpful. And again, needle exchange programs work. They were first established in 84 or 85 under Mayor Flynn. And it was very controversial when he enacted it in 85, but they work, and I support needle exchange programs. Boston Transportation, I'm going into Boston Transportation and Public Works. We were waiting for that one, Council Bach?
Yeah, I was just going to do 2 rounds just to give
okay.
a chance to get in, if that's okay.
Okay, let's see. I'm sorry, I'm just looking at my notes. I apologize.
No, this is the session. That's the point.
Okay. I think that's it for me, and I'll wait till the next. I'll wait till the next round so we go into. So was BTD part of this one?
No, but it's fine. So.
Oh, you want?
So I was just trying to give, it's fine because it's all part of this working session. So it doesn't really matter. We were just doing fire, EMS, public health, OHHS first, and then we'll do BTD, PWD, BPS second.
Okay. Let me hold off.
Okay, great. Awesome. I'll come back to you.
Thank you, Councilor Buck.
No, thank you, Councilor Flynn. Councilor O'Malley, and then it'll be Councilor Mejia, and then Councilor Braden's also joined us from District 9. Councilor O'Malley, this is so fire, EMS, public health, OHHS.
Roger that, Madam Chair, and thank you. And it's great to be with all of you on this beautiful Friday morning. If we were in the chamber, I would initiate a standing ovation for Chief Marty Martinez when he came into our budget hearing. So perhaps we'll do that remotely. But obviously, he has been an unsung hero of this administration over the last incredibly challenging 13, 14 months now. The first line of questioning as it relates to Public Health Commission, echoing what Eddie had talked about, as we sort of transition, as we're seeing some really positive trends as it relates to cases, as it relates to high vaccination rates in the city and the Commonwealth. What are boosters going to look like? There are people who've received their first vaccination back in February and may need a booster as recently as this fall. Will this be sort of the same hybrid public-private partnership for distribution? Will it just be at a healthcare provider? I'm just curious what the plan is for that. Secondly, the other unsung heroes of public safety, I wanted to obviously commend the men and women of Boston EMS, our EMTs and our paramedics specifically. These are among the hardest working individuals in the city of Boston. They have had an incredibly challenging year, as we all have, but particularly our folks in EMS, Boston EMS. And one thing that I've been pushing for, beginning with Councillor McCarthy, and certainly I know Councillor Flynn and Councillor Sabi George and others, is making sure that we have the correct infrastructure for Boston EMS. And there's nothing that, Eddie had talked about South Boston waterfront. Obviously, I support that as well. We need to have that as we're seeing populations grow. But even more than that, just having a centralized garage bay, looking at Franklin Park specifically, which is the center of the city of Boston, as we talk about some real upgrades and changes to the Shattuck Hospital site, that would be an ideal location for a permanent facility for the men and women of Boston EMS. This is something that would not be a budget buster in any sense of the world. In fact, it would help us save money in many regards. It would also then prevent the ambulances and other vehicles from just idling as they are. So this is something, it's a capital expenditure. It's been talked about for years. Every administration and every budget team since I've been in office have said this is a great idea, we should do this. We just haven't gone forward yet. So I want to see a commitment that that's going to happen, getting a centralized garage for Boston EMS. Again, I mean, Franklin Park seems to make sense just because of geography, but open to other ideas as well. So my colleagues may know, right now, ambulances are, assigned to certain geographical areas, and they could just be sitting in a parking lot waiting, for example. So this would help streamline that process as well. Next, I'm just trying to think, because a bulk of my questions are, bless you, that's little Margot in the background you may hear sneezing, are on BTD and Public Works. I guess fire, I'm more curious than anything else. What do statistics look like in a year when most people have been at home for the majority of their time? Have we seen a decrease in fire calls? Perhaps not. I'm not sure, but I'm just always interested to see what different trends we're seeing. Obviously, we're seeing far fewer fires than we did a generation ago, but we're also seeing some troubling stats as well. So just looking for an update on that, see how the staffing levels look, how people feel. Very delighted to see the Eggleston Square Fire Station well underway for a new fire station in my district, and just looking for just other trends that BFD has seen over the last 13 months. But again, as it relates to public health, job well done to our men and women of Boston Public Health Commission, specifically EMTs and paramedics, looking for support for them going forward in both infrastructure, in both staffing levels. I think that there is a renewed consciousness of health and healthful practices that we as a city can lead. So I'd like to actually see, there are some increases to the public health department's budget. I think that should grow even more as we talk about resubmittals and looking at other ways that we can support our community health centers and really just make Boston the most healthful city in the country. So that is all for this round, and I look forward to getting into Public Works and BTD for the next round. Thanks, Madam Chair.
Great. Thanks so much, Mr. President. Councillor Mejia.
Yes, good morning to my colleagues and to you, the chair. So, good morning. So my first three rounds of questions on the, let me read my glasses. So I'm curious if the fire department can expand on its knock and talk program. How many of these knocks and talks have been conducted, and how are the locations chosen for where they're carried out? I'm also curious about how the Boston Fire Department members are trained in multilingual communication in emergency situations. And then we noticed that there are no women in the top 10 earners within the Boston Fire Department, and only one person of color. I'm just curious, what are they doing to hire more diverse firefighting force, and to create professional development opportunities throughout the force as well. So those are some questions in that space. In regards to health and human services, I'm curious, how will the new director of youth and adult homelessness initiatives work with local organizations who are already plugged into the work for providing services to our area's unhoused youth? I'm thinking particularly about Bagley, the Trans Emergency Fund. And I'm curious about what does moving the Office of Returning Citizens do functionally to help our formerly incarcerated loved ones? I'm also curious in regards to Mass and Cass, what role, if any, they're playing to help alleviate some of the harm reduction concerns that have been raised over the last, forever, but I'm just curious of how they're leaning into that conversation and what supports they're looking at and need. And then for the Boston Public Health Commission, last year, then Councillor Janey wrote a letter to the mayor alongside councillors of color urging financial investments in order to eradicate negative health impacts that racism has in our city. How does the Boston Public Health Commission budget actually reflect this? The letter written by Mayor Janey also urged that all violence prevention funding be moved from the BPD to the Boston Public Health Commission. I'm curious if this is going to be reflected in this year's budget. I'm also thinking of any future granting, such as the Shannon grant, just kind of like having a better sense of how we're going to be reallocating funding to support some of our proven community prevention methods, and what does that look like? So just would love to hear a little bit more about that. And then I'll save the rest of my questions for round 2.
Awesome. Thanks, Councillor Mejia. Councillor Braden? And Councillor Braden, because you joined just after we started, so we're doing the first round's fire, EMS, Public Health Commission, OHHS, and then the second round will be the Public Works, Transportation, and
okay.
yeah.
Thank you. I apologize for my tardiness. I was on another meeting, and I may not cover all the ground. I may. We'll see how it goes. Fire department. I also wanted to echo my colleague Julie Mejia's question about progress on diversifying the fire department, language skills, and again advancement in the command structure of minorities and women is an issue that has been on the radar in the fire department for some time, but I'd just like a progress report on that. There's an issue here. This is more, I don't know, as I raised in the hearing yesterday with BCYF, I raised this in every department. I think it may have some relevance that we can try and develop a coordinated interagency or interdepartmental approach to finding support youth workers for our Fidelis Way and Faneuil Gardens, which are 2 of our public housing developments in our neighbourhood here. They have about 450 to 500 youth, children up and youth, and they haven't had youth workers for years. And during the pandemic, we saw an increase in violent incidents and an increase of problems, and we really feel that we need to address this issue urgently before we see a spike in teen pregnancies and increased substance abuse problems, and just generally a whole plethora of social issues that these young people need to have some structure. And youth workers, I am going to bang the drum in every department I think has some interest in this issue. Can we have an interdepartmental conversation about youth workers for these particular developments? And I'm sure there are other developments in the city would also merit some scrutiny on this issue. So that's something I want to talk about. So what else? What other department are we talking about here?
You went through fire. You did public health.
Public health. I think the youth worker issue is a public health issue, so I'll leave it there.
And EMS. Did you have anything on EMS?
EMS. I know we're in a conversation to try and find a new station for our EMS units out here. There was some conversation with St. Elizabeth's Hospital. I don't know where that is at the moment, but we do need a more centralized location for a permanent EMS station. I also would like some updates on the status of advanced life support, if we have an advanced life support ambulance in Alston, Brighton, because we're some distance from, I think the nearest one when we talked about this last year was maybe Beth Israel Hospital. So I just would like an update on that. And also maybe some breakdown on the number of calls that our EMS are called out in terms of substance abuse issues and overdoses. I know from talking to our police department that mental health issues and substance abuse emergencies are pretty high. So I just wanted an update on those sort of response rates to those sorts of calls in the neighbourhood. Is that it for now?
Yeah, that's it for now.
All right.
Great.
I'll come back for the next round is...
Next round is transportation, public works, and BPS, the partnerships, central office, a bunch of things.
Okay, thank you. Sometimes when I see all the I don't know, what are we talking about here?
Yeah, no,
that's very good.
we've tried to strike a balance with these working sessions of not having too many, but obviously that means that you lump a bunch of departments together. So
Okay.
I'll save most of my questions for this round. I'll just do them at the end because I want to let colleagues get theirs in and then go where you need to go. But I think the one thing that I'll raise that I have a bunch of questions about, because I just want people to know it's going to be a subject of our hearing, is that this alternative response model that the mayor proposed with a kind of 90 to 120 day timeline back in April. So there's 1.75 million for that in the budget, and it's under HHS. And so we talked a little bit about it with the police in terms of the interface with dispatch, but the design of it is really being run out of OHHS, the Office of Health and Human Services. So so I'm going to be asking them about, I know that they're in process, but my office, we've started talking to a bunch of other cities that do similar things. And so we're sort of interested in who are they talking to? What are they thinking the response team will look like? What we've heard from a lot of municipalities is that it makes sense to create these response teams that don't have police on them, and then have a specific set of calls that you're sending them to, and sort of curious what credentialing they're thinking about, how many people they're thinking to employ under the pilot, what the hours of service are. Are they thinking to target a specific section of the city first or to do it citywide? How's dispatch going to be trained to triage the calls? Is it just going to focus on mental health crises, or is there a broader set of calls that it might respond to? How are they going to involve community stakeholders in the development of the program? That's something we heard a lot of other cities had done when they did this. And so one concern I have about the sort of 90 to 120 day, we're going to design something out of, behind the scenes, is that it may not have that kind of robust community conversation involved. And then kind of knowing about how data will be tracked, and so we can figure out like what portion of 911 calls does this take over, and then the question about kind of, does it have, I think it would be very good for it to be something that goes through the 911 line because that's the number people know, but do you also have a secondary line that people can call when they just want that team? Or especially if community partners do, and kind of what they're thinking on training. So I think that if the council is going to be asked to authorize $1.7 million for the pilot, which is something I'm excited about, we need a bit of an update on their process and how they're thinking it through, even though they're not done yet. So that's going to be a thing I'm going to ask. And then I think that I have other questions, like I said, for EMS, public health, and for fire, but I'll ask them at the end of this. All right, so next I'm going to go back to the top and take the colleagues who are here on Boston Transportation Department, Public Works, and then with BPS, it's like central office, and then also partnerships, and then like food, school safety, and sorry, I should have my notes up here. Food, school safety, BPS, transportation, athletics, so that kind of stuff. Councillor Flynn, you have the floor.
Thank you, Councilor Block. Councilor Block, I wanted to highlight, as it relates to BTD and Public Works, the following, and I just, maybe I should have made it a little clearer, but as I discussed the EMS presence in the South Boston waterfront, we built a neighborhood in the South Boston waterfront, and we partially built the Fort Point neighborhood without any regard to basic city services, which includes EMS, which includes fire, police, library. So I had a discussion yesterday with a prominent business person and expressed my frustration and reservations that we don't have that presence in the South Boston waterfront. He agreed with me. the South Boston waterfront is almost 50% developed now, and we need to be serious about including basic city services in there. So I just wanted to highlight that. Council Box, so sidewalks in many parts of our city streets need repaving. That is true in the south end, in Chinatown, in my district, South Boston as well. Usually there is a patch when a 311 request is made, then it gets referred for permanent repairs. Like, my question is, how long does it take to usually get sidewalks permanently repaired? Neighbors are also concerned about the lack of notification when they are doing sidewalk repairs. And how can we better communicate with our neighbors about Public Works Department? I think the Public Works Department does an exceptional job in our city. The reconstruction on Beach Street, which basically runs from the Leather District into Chinatown, was funded a couple years ago. It was supposed to be completed. We know that the Leather District portion of Beach Street was worked on, but the residents didn't see any work on the Chinatown portion of Beach Street. Can we clarify the project scope? Would we be able to repave or upgrade streets and sidewalks in Chinatown? And I say that because in Chinatown, many of the residents there are seniors, and many of the residents are families with young kids, and they're bringing their little kids to school. So about the last thing I ever want to see in my district is seniors having to walk in the street because the sidewalk is broken. So I want to make sure we try to get as many of these sidewalks filled as we can, fixed as we can. I think that's critical. Neighbors in the South End are eager for the Albany Harrison Avenue redesign to begin, which has been in the works for a long time, and it was funded in our capital budget for FY21. What is the timeline now, and when can the project start? Just looking at my notes here as I continue. Just give me 1 minute, please. Okay, I'm sorry. I'm sorry, Council Buck. We would like to see more infrastructure improvements in the form of speed humps, raised crosswalks, rapid flash beacons, road diets, curb extensions, speed feedback signs, all-way stops and pedestrian islands, more blinking pedestrian signs. I was on a meeting last night, I believe, with some residents on First Street and Summer Street, talking about pedestrian safety. And someone had a radar gun, and they were checking the speeds of people driving down Summer Street. Some of the speeds were as high as 90 miles an hour going up L Street. Many of them were 80 miles an hour, 70, 60 miles an hour. We desperately need to lower the speed limit, but even more importantly is the enforcement of the current speeding laws. Working with BTD and BPD is critical. Residents want a speed bump on L Street and 6th Street like they have on Marine Road, or 6th Street, as cars continue to go very fast between the lights. We want blinking pedestrian signs at L and 3rd Street, where the car crashed into a building recently. Southie neighbors will only cross streets at the lights on Broadway, 5th or 8th Street because they know many of the streets are unsafe, including my parents, who are elderly parents, and they do a lot of walking with their grandson, who's special needs, a special needs boy who has difficulty walking, but my parents walk with their grandson, usually on the weekends to church or to the library. And speeding cars are a problem, even when you're in the crosswalks for seniors. People will drive right by you in the crosswalks. Is there an update on all the way stop at Pappas Way and First Street? Is there an update on a rapid flash beacon on East Broadway at Stop and Shop in Walgreens? Making one lane from L Street to Perkins Square or G Street to avoid double threats where the first car lets you go, but the second car flies around you. That's how our friend Richie DeVoe was hit on K Street in Broadway. Richie's a good friend of ours. The lines painted for 2 people make cars speed or pass on the right. It's unsafe for families and our seniors to cross. Is there an update on a road diet on Preble Street near Andrew Square in the Rotary at St. Monica's? We need to also coordinate with the state on the blinking pedestrian signs. We have a little bit more work to do out in front of St. Peter's School on some signage. Again, more enforcement in South Boston on non-resident stickers, out-of-state plates. Again, want to highlight the excellent job of our dedicated city employees. Council Bach, are we going into BPS now, or should we?
Yeah, you can go into BPS now, Councillor Flynn.
Okay. Many of our students unfortunately experience hunger at home and rely on school breakfast and lunches. Are there any plans or programs that address this issue, especially during the summertime? And I know I've spoken to the superintendent about this, but I'm concerned, I'm troubled about this summer, especially for our immigrant students, immigrant families, for residents living in public housing that don't have the access to the services. What specifically are we doing to help young people in public housing in the immigrant community during this difficult period of time with services? Myself and Councillor Bach talked about as we talk about public housing, Unity Day. It's probably one of my favorite days of the year. I know this is not a BHA thing, a BHA segment, but BHA Unity Days play a critical role in bringing our neighborhoods together as well. Want to give a shout out to BHA, but to ask to make sure that we have a complete list of all the BHA Unity Days and where we can partner with various city departments to have them present where they might be able to provide some social services or updates on some of their programming. Madam Chair, I have other BPS related issues, but I'm gonna hold off on that, and I'll do it at another time. But I thank you for giving me this opportunity, Council Buck.
Great, thank you so much, Councillor Flynn. Councillor O'Malley?
Thank you, Madam Chair. So I'll start with BPS just because I have one specific question on that. I had raised it at the budget hearing earlier this week, but it's probably more appropriate for me to raise it in this form, and that's, and I hope no one reads it as an indictment of the great people who work in central office, but it seems that every year we see more and more individuals, which is great. We know there's a lot of work to do, but I'd like for the council to be furnished with a list of everyone's name, title, and salary that works specifically in central office. So that's the BPS one for now. We can get into more specific ones as we get into the hearing. As it relates to Public Works, obviously a shout out to Freddie Mycroft and the great team down in District 6, and Robert Lewis as well. I'm curious about costs associated with our trash pickup and recycling. I would, again, think that this could be an anomaly of a year where I know my family was generating more trash because we were home for so much more, and I'm curious how that affected our rate. We are one of the few municipalities where our recycling still costs less than our trash pickup, which is a very good thing. It's not nearly the revenue generator that it was a decade ago, but it's still less than just trash, which is one incentive for people to recycle more. So I'm curious what those figures look like. We're locked in at a rate, so that shouldn't change, but I'm just curious, what this year's collection looked like as opposed to last year. Also, since 2012, I've been working with myriad colleagues on getting a curbside composting program started, and I know virtually everyone on the council now supports it. We were told that the funding would be in for last year, and due to the pandemic and some other things have been held off. This is a subscription service, so this is zero cost to the taxpayer, and it's obviously voluntary, but leveraging the buying power of a city contract, we'll be able to negotiate better deals for our constituents. I need to know when that will start, and I'm going to be absolutely vociferous on this. If we cannot get this on the books, then it's going to be very, very difficult for me to vote for this entire operating budget. I am that serious about this. It's been 9 years we've been waiting, and I will not wait any longer on this. So I need a concrete timeline when we will have our curbside composting program happening. And again, one of the reasons I'm so passionate about it, it's obviously good for the planet, but about 25% of our trash that we're burying right now is organic, which means we could save a quarter of our tens of millions of dollars of trash collection costs right now. So again, this is something that is good for the taxpayer, and as someone who takes the financial health of our city very, very seriously, this needs to be ready to go now. Similarly, another thing that we pushed for was textile recycling, which can still generate a revenue. So that's another thing that I want Public Works to be able to grow. We've seen some bins pop up, which is great. I appreciate that. I'd like to see that expanded as well. As it relates to BTD, ECHO, I know Councillor Flynn talked about a number of traffic calming measures. Obviously, it's what we hear about constantly, and it's what we need for safety. So looking at new innovative ideas. And seeing what the timeline is on that for speed humps, speed bumps, beacons, etc., other changes to the road design. Excuse me, Margot is helping out with this. Okay, honey? She's okay. And I just lost my train of thought. Oh, on BTD as well. I know that we have a website in terms of the layout of street repaving, what the priority is. Usually that's a pretty good barometer, but not always the case. So looking for more clarity on that. I want to see if we were able to do some more road work, given the fact that there were fewer cars on the road. I was proud to have played a role with this council in our micro-mobility study. And I mean, this can and should be a conversation with me and Chief Osgood, just figuring out where we are with our micro-mobility, which is allowing a piloted e-scooter and electric bike usage. A lot of cities have actually seen their usage climb dramatically during the pandemic. So it's something that we perhaps have missed out on. But again, we want to make sure we do it right. And I think that is basically it for BTD, Public Works, and BPS. But again, to all of our civil servants who serve in those capacities, just thank you for great work in a really, really challenging year. And we're just really grateful for all of you. So that is it for me, Madam Chair. Thank you.
Thank you so much, Councillor O'Malley. Those were great. Next up is Councillor Mejia, and then it'll be Councillor Braden. Councillor Mejia.
Yes, okay. So Councillor Bach, I just want to say thank you again for hosting these working sessions, because it helps us move the work literally along. So you're dope. I appreciate you.
Thank you for joining them. I appreciate that.
Yeah, they're important. So for the BTD, there's a few little commentaries and just some questions here. There seems to be a disconnect in many communities between things like public transit infrastructure and public safety. A lot of people in our neighborhoods, like in Dorchester, Roxbury, Mattapan, Hyde Park, are more spectacle of riding their bikes to work when we're dodging bullets out in these streets. So I'm just curious how we are coordinating public transit infrastructure efforts alongside violence prevention strategies. I oftentimes feel like everyone's operating in their silos, but we do definitely have an opportunity to see the intersection of these things, so that we can get more people on bikes. We also need to address the issues of violence, and I'm curious what, if any, efforts are being made to do just that. And in regards to the workforce, we know that Black and Brown people make up 36% of our workforce, but 0 of them are their top earners in terms of salaries. And so I'm just really curious about what is the plan to create avenues for professional development for Black and Brown employees. I think that that's a big discrepancy there, and I think we have an opportunity to shift that. And I also think that one of the things that we heard a lot about, especially like around the American Legion Highway area, just kind of like the process in terms of how we're deciding where we're putting bike lanes, what that community engagement process looks like. I do believe that there needs to be some sort of, I guess, if you will, a report back, or just like, here's what we heard post these conversations, just to what level of engagement are we looking at in terms of like once these decisions are made? Do they do any follow-up? In regards to BPS, we're seeing a reduction in staffing and in budgeting for athletics this year. So what is the reason for this cut? Food service and lunch monitor funding is also being cut. Can the administration talk about the reasons behind these cuts? And while we're talking about lunch, we've been hearing more and more we've been getting more calls to invest in more local nutritious food, but we're still operating under a giant contract. Has the administration conducted any outreach or community conversations around the possibilities of breaking up that contract and relying more on locally, culturally competent foods? I think, we're spending a lot of money on food that kids are leaving untouched. And so if there was an opportunity for us to support our small local restaurants, why not do so? Like, what is the resistance to supporting local businesses? I think that if we have the will to do so, there's nothing that we can't do. So I just want to know why can't we, and what's the problem? Because once we know what the issue is, then we can better manage our expectations. But I have yet to hear why we can't do that. And so I'd like them to come with a clear answer around that. I don't know, Councillor Bach, if this would be the right place for this particular BPS situation, but I'm curious about, I know I keep asking about the number of lawsuits around special education. I'd like to know how much money we're spending on defending those, as opposed to actually delivering the services. So I'd like to get some answers around that. And I also would like to get some answers around just the McKinley schools and some of the community engagement efforts. So would like to hear about that. And, in regards to Madison Park, we know that everyone's been fighting for that school. I'm just curious as to what the administration is thinking of doing in terms of real investments. They're already thinking about changing the leadership, and I feel like stability is important. And so I just would like to know what are some of the investments, dollar amounts, that they're going to be making to help support Madison Park. That's it, Councillor Bach.
Great. Fantastic. Thank you, Councilor Mejia. Yeah. And all those questions, I mean, a couple of the things like the lawsuits question we're sending over as info requests after the last hearing anyways, but happy to have it in here too, make sure we get an answer. Great. And now Councilor Braden.
Thank you, Madam Chair. I also want to echo my appreciation of doing these working sessions. It helps us get to grips with the actual nuts and bolts of the budget and get drilled down. Let's see. One concern that I have is with regard to the BTD. We have had an extensive Alston-Brighton mobility study that has gone on over about 3 years, and the final recommendations for a plan were published this week. It always, as with all of these improvements, we have great plans, but then we throw the ball, the BPDA throw the ball to BTD and say, on you go, implement these recommendations. And it's become apparent that, they just don't have the bandwidth or the staffing to really execute a lot of the recommendations. So I would like to know what the situation is and what they see. I know recently the BPDA are in the process of transferring funds to the BTD to try and implement some of these recommendations, but it seems to be a rather unsatisfactory arrangement that they're depending on the that sort of case by case transfer of funds to try and do the work that they have to do on a daily basis. I also wonder, there's an issue with the BTD in relation to our compact living pilot. The units have a very low parking ratio, and the only way it will work is if residents in these developments do not get resident parking stickers. And I know we've been told by the BTD that that's unenforceable and they can't do it. But if we are seeing increased numbers of these compact living housing situations with a very, very low parking, little or no parking ratios, then we have to come up with a workable solution to stop people just trying to park in the street, which has become an increasingly difficult situation. And with regard to the DPW, I had a question about the Monastery Path between Warren Street and Washington Street in Brighton. It is a pedestrian pathway that monies were set aside from one of our big development projects to help restore that path. I just want to know progress on that and a status update. And then also there's another path called the Foster Street path that goes between Wilshire Street and Foster Street. It's actually a very pleasant walk and a great shortcut in the neighbourhood. It's through an urban wild, and it needs, the pathway is just totally eroded and broken up. It needs to be restored and I'm thinking a permeable pathway and plantings and signage would be a very good addition there. I had a question about the use of salt in the winter. With changing weather patterns, we're seeing less snow, but we're still seeing a lot of icing in the winter and dangerous road conditions with black ice. I'm just wondering, in terms of, do we have other options for treating roads other than salt to try and not increase the salination of our waterways? Let's see. I also want to echo Councillor O'Malley's appreciation of the textile recycling boxes. We have one in Brighton Centre. I'd just like to know where else. Do we have others in the neighbourhood, or where are they across the city? Is there a map that would indicate where we could take our textiles for recycling? And then with regard to BPS, this is an issue that's come up recently with some of my constituents. Apparently, there are federal funds allocated for special education services and equipment for special ed students who attend private, religious and charter schools. And I just would like to know how much money comes in from the federal government and how much of it is spent. I heard, and this is hearsay, that they had to return $30,000 that were unexpended recently, and that could be complete hearsay. It may not have any basis in fact, but I would like to get some more information on that issue, and to ensure that the students whose parents choose to send them to a different school, that those special needs students get the services that they need. And I think that might be it. Thank you very much.
Fantastic. Thank you, Councillor Braden. I will do the rest of my questions now, but before I do, I just want to give councillors who are still on a chance if Councillor Flynn or Mejia had any like last minute questions that you thought of that you wanted to get in. Just raise your blue hand or let me know. Otherwise, I'm gonna go to mine. Councillor Flynn?
Yeah, thank you. Thank you, Council Block. And I just wanted to highlight one issue on as it relates to BPS. Certainly, it's an issue I've highlighted recently and highlighted in the past, but I'm really asking for BPS to think about how we provide some instructions to students about the proud accomplishments and sacrifices of immigrants. You know, making sure that whether we formally do it in a curriculum, which I think would be more beneficial, or we study it. But I would like us to have a curriculum where we study and acknowledge and read about and educate our young people about the contributions and sacrifices of immigrants, how they help build our country. A lot of people don't know about the proud history of immigrants, and they're not here. Immigrants are not here and not working. Immigrants contribute every single day to our country. And the frustrating part for me is we don't hear about many of the positive stories about immigrants. And I think that's needed. We also seen a rise in violence against the AAPI community, which I would like to see as part of the BPS curriculum. And I think that would help our city. And I would help our city unite and treat each other fairly and with respect, but in celebrating the AAPI community instead of placing blame at them and their families on this pandemic, which had a devastating year on the Asian community. But I've talked to the superintendent about it, and it's something that's important to me because it's important to my constituents. And I know it's important to a lot of immigrant families too. They want their story told. And the best way to tell their story is educating young people in the BPS system. Thank you, Council Buck.
Thank you so much, Councillor Flynn, for that important point. Councillor Mejia, Councillor Braden, any last things? I'm trying to give everybody a chance because I have a long list of questions. So I just.
Thank you, Madam Chair. I'm all set. Thank you for your facilitating this conversation this morning.
Okay, great. All right, then I will jump into Councillor Mejia. Anything else?
No, I think I asked all my questions at this point. So right. I'm just here listening to all the other stuff y'all got to say, but I can go and listen.
No, you're welcome to listen here. I didn't want anyone to be waiting impatiently. So I will jump into mine. So on the fire side, wondering when we actually expect the Engine 33 project in the Back Bay and the Engine 37 project in Fenway to get scheduled. Love to hear a timeline on either. Also hear the status of the fire alarm roof and antenna design project in Fenway Kenmore. Interested at the fire alarm building, just in whether we need, as the Muddy River gets revamped and everything, whether we need to capture quite so much space for fire-related parking, or if we can give some of that back to the park. Wondering if the HVAC boiler replacements can expect any energy and cost savings. There are some decreases in the training, health, safety, and wellness and fire prevention budget line items. And I suspect there's sort of simple explanations behind that, but if they could just speak to the reductions, that would be great. The other colleagues have already asked this, but just where fire is on, the efforts to recruit women, folks who don't identify as male, and make the firehouses, more welcoming and safe spaces for them. And then also, to, I think it was Councillor Mejia's point, create pathways to leadership. I think it's really important. And I would also love an update on the knock and talk program, what they think the reason is behind the decrease of the percent of calls responded to under 4 minutes. Since so that's gone down 20% since 2019. So that's obviously on the face of it a little bit concerning. And then just weather fire, one of the things that I've seen is that there are a significant number of fires that don't require the full, that are sort of the types of calls where you don't need the full large trucks. And I'm sort of curious about whether we've thought about acquiring some of that more nimble apparatus just for getting around the city streets. I've got lots of historic streets that are, grandfathered in. And while I know that the fire department wishes they were all 20 feet wide, I think, we could think about having some of that smaller, more nimble apparatus too. So just would love to hear, there's a fair bit of it that you could do with something that's more van size. So just wondering whether there's been any investigation of that. I already asked my questions about the OHHS pilot for alternative response. The one other question I have for them, and it's kind of falling across a lot of different categories. It could also be a public health question, but sort of the plan for getting us more 24/7 public bathrooms throughout the city. I know there's a bunch the public facilities administrators that are under a contract with JC DeVoe that have been shut. How are we getting those reopened? And I know there was some talk of pilot this summer. Councillor Baker's asked about that too. I really want an update. And I just think that bathrooms are one of those things that literally everyone needs. So I would love to talk about that. I see that we've been joined by Councillor Flaherty. So I'm going to interrupt my questions. Councillor Flaherty, thanks for joining us.
Thanks, Madam. Thank you, Madam Chair. Just an update, obviously, on the 2 district chiefs that were removed during the Menino administration, and see whether or not we can get those 2 district chiefs positions restored. One obviously is over in the West Roxbury area, given the significant and serious pipeline concerns from the residents in West Roxbury and throughout the Southwest corridor. To remove a district chief was extremely careless. So would like to see a district chief restored to that district. And also the one over at the Longwood Medical area, portion of your district, Madam Chair, also lost the district chief position. And if there's ever an area where someone wants to really wreak havoc and cause serious disruption, it would be over in the Longwood Medical area. So we also should have a district chief car over there. And clearly the backfill will obviously serve to diversify the command staff as well. So all good stuff. Could be a win-win. Not quite sure why those 2 district chief cars were removed other than political retaliation. But nonetheless, time has come to have a conversation about restoring in the interest of public safety. And again, given that it's Longwood Medical area, and again, given that it is over near the pipeline. So those are important questions that need to be addressed and that I'd like to see added in the budget discussion. And trying to see if anything else comes to mind, Madam Chair.
So Councillor Flaherty, besides fire, because we're doing a whole grab bag of things here. So we've got fire, but also if you have anything for the Public Health Commission, EMS, or the Office of Health and Human Services.
No, obviously just, and also the same line is to encourage those different departments to talk about and to support chiropractic services being on the formulary for City of Boston employees. We talk about sort of lost man and lost woman hours when they have to get a primary care doctor, then see a specialist, and then there's time off, and then there's FMLA, et cetera. Folks are on pain medications when they could just go to a chiropractor, get an adjustment, get back to work as quickly as possible, in some instances the same day or the next day. So not sure why that continues to be a head scratcher, but it'd be great if all departments would encourage that and not have it be part of bargaining. It should be part of the city's formulary. When we're doing business with insurance companies, we should just be using our bargaining and buying power, if you will, as the consumer, and requiring them to come to the table with chiropractic services on the formulary. Often we're watching the administration, they want to talk about negotiating it. Well, if you're going to put that on the table and that's up against wages and benefits, et cetera, what do you think people are going to take? They're going to take the higher wages because not everyone takes advantage, obviously, uses chiropractic services. But if we want to talk about getting folks back to work as quickly as possible, we need to start talking about having that added to the formulary. And that's all departments.
Yeah, great. Thanks, Councilor Flaherty. And then we're also doing, if you had anything for the Transportation Department and Public Works.
Yeah, obviously on the BTD stuff is the stuff we continue to advocate for with respect to Vision Zero and just trying to make sure that our streets and sidewalks are safe for pedestrians, cyclists, and motorists alike, and making sure that we're doing an audit on our crosswalks to make sure that they're clearly visible and illuminated where possible, and also signage across the city. And it's so convoluted. Go up and down any street in any neighborhood, in any district of the city, and try to make sense of some of the signs. So at some point, I think we're going to need to do an audit on the signs, or maybe we create a sign czar position and bring some sense to the signage. And that goes from resident parking to street cleaning to do not park to loading zones, et cetera, et cetera, et cetera. So time, I think, has come to sort of restore some sensibility to signage. Some signs are not clearly visible. Other signs are missing. Other signs are pointing at each other. It goes on and on. So I'd love to at some point have a discussion and have it be part of sort of maybe a capital plan where the city and its transportation department will literally go street by street and restore signage order. So other than that, I'll think of some other stuff. I know that we're working closely with the commissioner. Commissioner Rooney has been doing a great job at the transportation department. He's very responsive. So anytime me and my staff have a transportation issue, he's been excellent. So
Great. Thank you so much.
Thank you, Madam Chair.
No, thanks for joining us, Councilor Flaherty. And now I'll go back to questions that I'm going to ask. And then I've also got some questions from Councilor Arroyo to read. So for me, back on EMS, just I think there is a decrease in the EMS budget. It might, again, be a kind of money moving around thing, but if they could just speak to that. And then EMS's involvement in shaping the alternative 911 response and what their current training for mental health response is, and whether there are calls that just EMS takes, and just kind of thinking through that, because they're obviously a really valued resource. And then kind of just continued work on diversifying the workforce and where we are with that at EMS would be great. And on the Public Health Commission, would just would love to get a bit more, it's sort of a D&D question, but it's sort of a Public Health Commission. So I'm going to ask it to both departments to sort of talk about their youth and young adult homelessness work. We've put a bunch of money in on the D&D side, but there is a public health piece of this, and would love to specifically understand with the shelters, how, like, what we're doing to be friendly towards young adults. What about LGBTQ young adults, who we know are a disproportionate proportion of homeless young people? Obviously, Cambridge has a sort of more dedicated shelter targeted at that population. We don't have that. What's our progress? How are we thinking through that piece? And then if they could talk about the reason for the overall decrease in the Homeless Services Bureau. I think, again, it might just be an accounting thing, but we just want to know about that, because obviously we want to see those services continue to be robust. Would love to hear, this is an OHHS/BPHC question. In some ways it's really for the chief, but thinking about plans to use federal funds, the vision and the kind of categories that feel like where he's going to be advocating for allocation of those funds as this committee, and then Councilor Flaherty's committee kind of does oversight of that. I think it'll be really helpful to have that conversation in the hearing. Talk a little bit about the Consortium for Professional Development line item. We weren't sure what that was. And talk a little bit about the functions and programs that are carried out at each property. Obviously BPHC actually has a number of sites around the city, and I think it would just be helpful to understand what happens at all of them. As a new counselor, I still don't fully know that. And then, talking again about rapid rehousing and such. Again, that might be a D&D question, but to the extent it's a public health question, we'd love to know. if we get a little bit of a take on the environmental hazards piece, again, that's a line item. I don't know whether that's something that companies and landowners are cleaning up and mitigating. Just would love to understand how that all works. And then whether, I think we've been talking a lot about racism as a public health crisis and about sort of disparate impacts and how the Public Health Commission is really re-gearing to work on. I mean, it's continuing the work they've done in COVID to think about things in that vein. And one population that I'm trying to advocate for throughout these budget hearings is our Native American and Indigenous population in Boston, because I think because they're statistically such a small number, they sometimes get left out of the kind of convenings and conversations, the data. And then there are a bunch of folks in that community who they don't technically live in Boston, but Boston is their community hub. And so just would love to hear how the Public Health Commission is thinking about and working with that community, and what specifically they're doing. And then my impression is there's been quite a lot of unfilled positions, over the years and in this COVID period at BPHC. Obviously, Rita's been doing a great job as the interim director, but the director role, COVID did kind of hit us not having an infectious disease director. And in general, I think that, while we've responded amazingly, and I agree with Councillor O'Malley's kudos to the whole team to COVID, it did find our public health infrastructure for infectious disease handling, along with that of the rest of the country, behind, right? Like not having been something that we invested in. So, fooled us twice, shame on us. So I'm sort of like, okay, how are we thinking? We're all feeling a great sense of relief to be out of the pandemic, but unfortunately we can't just tell ourselves, well, this won't happen again for 100 years. That's not an inevitability. And so I would really like to know, as we come out of this, what we're doing to soup up our infectious disease infrastructure and hiring and all of that. I think those are my main questions for BPHC. And then I am going to ask my transportation questions, but I'm going to pause for 1 minute and plug my computer in, or else this hearing will be abruptly ended. So, with a request for everyone's patience. Okay, I am back. Have battery power now. Okay, so for me, for the Boston Transportation Department, understanding the continued bike lane rollout context, obviously we got a bunch of those with Connect Downtown down this year. I think there's probably some work still to do kind of more collaboratively with the community on the rest of the network, and also on thinking about, like, we sort of just laid those down around the parks, but we didn't change anything about the islands and the infrastructure of the crossings at the corners. And some of them are a little wonky. So want to check in about that. Definitely what the delivery timeline is on the one on Boylston Street over in the Fenway, where of course, it feeds into that intersection where we had really dangerous, we've had it's an ongoing dangerous situation. And unfortunately we had a fatality a few years ago. And so I just, I've gotten updates from the team on that, but the timeline has shifted. So I want like a kind of updated update on the timeline. I am interested in whether there are places where, particularly complex intersections and stuff, where we could think about having like signalized lights for bikes at ground level that are kind of at eye level in the same way as we have for drivers. I don't think we need that everywhere, but I think there are some places where it could actually really help. Just want to hear about the thinking about that. I have some resident parking issues. Got to talk to the state about Mugar Way, but in the West End, just putting it on the radar that there continues to be a sort of sense of inequity about access to residential parking in the West End. Saw that the Office of Streets reduced its contracted services. So curious whether that's just something cyclical or services coming in internal. Talk about the expansion of the Open Streets program. I love Open Streets. Are we going to do them places where there might not be a Main Streets district? Because I've got a lot of those places in my district. And kind of how, in general, this is probably BTD and PWD question, how we're thinking about extending some of the things we've learned in the pandemic and some of the like outdoor patios and such that we've been able to do into the post-pandemic world. They could talk a bit about the Transportation Community Leadership Academy that's being proposed in the budget book. And a bit more about the subsidies for public transit that were introduced in the budget. And just this is me beating on something that I and a lot of people in the council really care about, but just how we are accelerating the execution of a real Vision Zero plan. Again, what's our kind of signalization update? What's our kind of our scale of change for making unsafe intersections safer? We were talking with Landmarks about the backlog of dealing with landmark petitions. I think there are a bunch of intersections in the city that we know are unsafe, that we know need redesign. Kind of understanding what we understand to be the timeline for really tackling those would be great. Totally agree about refreshing our crosswalks. I have checked in with them recently, but just really want to emphasize the need for a coherent, complete, kind of solution on Blossom Street to be a part of what comes out of the MGH project in collaboration with MGH. In Back Bay, we definitely want to hear the update on kind of, I know we've been working with the commissioner around sort of an inventory on the parking side and making sure that our mix of meters and residential parking makes sense for the current uses today. Also, Beacon Street, obviously we did narrow that street in order to make it safer and slow things, but we still get a lot of speeding. I've had some requests about raised crosswalks there, still have them throughout, really all over the place. I think the department has most of the specific places for me, but everywhere from Mission Hill to Beacon Hill, I've got the requests for raised crossings. And I think it raises again the issue that we brought up last year, where in last year's budget, there was kind of a discussion of the idea that there would be some of these more tactical interventions for slow streets and safe streets that we would be able to put down without winning the whole slow streets program. And I haven't really seen that move in a way that's been discernible as a counselor. So need to talk about that. Continuing efforts to diversify BTD's workforce. I think that I'm just sorry, I've got lots of questions. I would love an update on how the department's thinking about the interaction with DCR around the parkways and the question of it's very unclear. It seems like we actually should control parking on the parkways, not just we morally should, but also that we may actually legally control it. So want another check-in on that. I already mentioned Boylston Street and Fenway. We need it to be so much more friendly, not just for bikes, but for pedestrians. It's critical. And I've already got folks so concerned about crossing that street there, and so many seniors. So it's just crazy. Definitely want to make Brigham Circle safer. That's an ongoing issue. Longwood and Huntington, figuring out what we're doing with the Huntington, South Huntington money to make that intersection safer. The overall, I think we continue to have, despite the BTD's work, not with the MBTA, which has definitely improved over the last few years, continue to have challenges with the quality of the streets around the rails, where the rails run from Brigham to Heath. And it creates a lot of potholes and stuff that are tough for my folks who are using wheelchairs, bikers, et cetera. So figuring out how we can get a more solid maintenance plan going with the MBTA and BTD. And the problem is, the issue is really where the line of jurisdiction is. That's where we find that problem. And then I've talked extensively with BTD about the Terrace Street issue, Gurney Street, the mid-block crossing by Roxbury Crossing, something we hope can be part of the MBTA project, and a whole bunch of places where crossings are not safe. I want to stress what Councillor Flynn mentioned, the issue of just sidewalks, the lack of transparency for folks about how quickly a sidewalk's going to get repaired, when it'll get really repaired versus patch repaired, and just the fact that like we do have so many places where you have to go out on the street if you're in a rolling device, and it's not safe for folks. And we have a lot of those along Huntington and in Mission Hill, but we have them a lot of places. We also have a lot of brick sidewalks in my district, and I continue to be frustrated that it feels like because they're more expensive to repair than other sidewalks, we leave them until they get into a pretty bad state of disrepair. And some of them are really heavily used. For instance, we continue to really want a complete refresh of the Dartmouth Street bricks from kind of Boylston to Beacon, which is a major thoroughfare, folks going to the Esplanade, tons of tourists. And we did do some nice work around the memorial at Newbury and Dartmouth, but we didn't do kind of an across the board redo. And it's something that I hear a ton about from my constituents, and really would like to see happen in this budget. And then with public works, where we are, I'm thinking about permeable pavers, making them part of our defaults. And, you know, is there permeable? Somerville did a cool thing with a permeable bike lane. Is there something we could do there just to, you know, help with stormwater management and also reduce puddles in the bike lanes? How could we make that part of our kind of standard reconstructing and resurfacing? Would love, like Councillor O'Malley, to have a kind of map of street resurfacing, because I feel like it catches me by surprise. And then there's lots that I think should be happening and are not happening. Really want to talk about the sidewalk snow removal piloting this winter. That's a public works question. And then, yeah, just like what we could do as a first step there. Would like to talk about that again. And I think I already mentioned workforce diversity, because it's the same on the public works side as the transportation side, especially with women. So want to hear plans for that. And then if we can talk about public works' role in and plan for kind of like zero waste, like is there a role for public works in the green jobs training that environment's leading? I want to think about how to create a pipeline for residents into public works jobs that's also a pipeline into a broader set of jobs. So just would love to talk a little bit about that. And I think those are for now I think like many district councilors, I have a sort of infinite list of transportation department and public works questions, but those are some of the main highlights. And then on BPS, just want to hear about what I know the superintendent's previewed kind of athletics and arts funding and trying to make that a more complete part of our schools, which I think is super important. At the same time, you know, obviously the federal funding we need to use for one-time things. So just would love to hear how that's interacting a little bit more. I already asked this to the transportation department, but I haven't heard yet the right answer. So we keep renewing the TransDev contract for single year terms at BPS with transportation. When are we going to be in this position to issue a new RFP to adjust how we dictate the service that we want and pursue competitive pricing? I know they said that was in the works. Would love an update. And sort of anything that's kind of an overall long-term transportation plan vision update since we last talked, and also where the transportation budget is actually landing for this year, because it was coming in $1 million under, but I suspect that now that we've reopened, it's in fact coming in over. And I know there's some COVID money available, but would like to know an update on that. And we got an update from them on the electric vehicles, but just anything more about that. And I think I already mentioned that the RFP needs to be, it also needs to just give us more flexibility than we have right now, so that we can really get transportation costs down as we reimagine things. And then where we are on getting more reliable bus monitors, whether that's compensating them better, shifting the way that they can be shared, and how often students are left without a bus monitor and so without transportation. And then just curious if the non-BPS student transportation budget we expect to grow because of the loss of enrollment, or if we think that more of those folks are leaving to schools that we don't transport to, just trying to understand what the effect of enrollment decline is on the transportation side. As we think about alternate 911 response over in the public safety side in the schools, sort of how we've thought about alternate responses to kind of like school police within the schools would be great to hear. There's a security aid role that's described. I'd love to understand like what that is, who that is, what they do. There seemed to be a little bit of inconsistency between the request for information response we got and the budget book about school police officers. So if we could just get definitive numbers on that. And then the total number of library staff across BPS, whether and again, it seems like there was some discrepancy between our request for information response and the budget book. So that might just need reconciling, but would love that. And then kind of if they could focus in on the contracts for food and nutrition services, what the quality of those is, where they're sourced from, how we're thinking about diversifying and breaking them up. I know there's been work and thought on this. Would just love an update for the council. And then what we learned in the food process of this year, which has been nothing short of a Herculean effort by BPS, and what learnings they're taking from that in terms of providing more robust food support, even as we come out of COVID for our families. So those are my questions. And now if you're still with us, bless you. I'm going to read a set of questions from Councilor Ricardo Arroyo from District 5 so that they're on the record. And that will be the conclusion of this working session unless someone else pops in the meantime. So from Councilor Ricardo Arroyo for the fire department, why is the department's BFD training program budget decreasing by almost 9% in FY22? Can the department talk about moving the cadet program funding to contracted services? Compared to last year, BFD has the same percent breakdown by gender of its employees, 6% female and 94% male. Can the fire department talk about its efforts to try to increase the number of female employees and reduce this gap? I just want to say because Councilor Arroyo here reminded me of it, I think we want to know about the fire cadet program implementation in general. It was a big deal to get that approved through the state legislature at the very beginning of this year. And I think we're going to want an update on what implementation looks like. Last year, there was a breakdown of 16 top earning employees with 94% white. And this year, there's a breakdown of 19 top earning with a similar 95% white. So what efforts are being made to diversify BFD's workforce so it reflects the diversity of Boston, especially in terms of the leadership and top 10 department salaries? Can the department talk about the elimination of the safety, health, and wellness grant from its external funding and what impact this will have? Does that program include mental health supports for firefighters? If not, what part of the budget includes these services? How many women liaison positions does the fire department currently have? Are there any plans to expand the number of liaison positions? What additional resources has fire allocated for the upcoming year toward making women feel safe and supported within the department? What policy changes has the department implemented since FY21? Does the department provide any kind of trainings or workshops to employees around workforce discrimination, harassment, and investigation or reporting systems? What percentage of fire staff is fully vaccinated? How is the fire department working to ensure that its staff is fully vaccinated? And will the fire department require employees to be fully vaccinated to continue working? Then Councilor Arroyo asked for Boston EMS. Why is Boston EMS's FY22 budget set to decrease by 2.5% from FY21? What does this decrease represent? How is EMS working to ensure that its employees are representative of the diversity of the city of Boston? What efforts are made over the past year, given that the breakdown looks almost identical to the information provided last year? What percentage of Boston EMS staff is fully vaccinated? How is Boston EMS working to ensure that its staff is fully vaccinated? And then for the Public Health Commission, what is the status on appointing a permanent executive director for the Public Health Commission? Why has the Public Health Commission only had an interim director for over a year now? Can the commission talk a bit about the annual $100,000 for state of emergency for communities of color line item within the Infectious Diseases Bureau? What does this investment actually fund? Why is the racial equity and health improvement line item within the public health services centers set to decrease by about $500,000? What will the impact of this decrease be? BPHC's breakdown of top 10 department salaries shows 80% white, 10% Latino Hispanic, and 10% Asian, despite 37% of all BPHC employees being Black. Can BPHC explain this discrepancy and efforts that are being made to ensure that Black employees are not locked out of these leadership opportunities? Does any part of BPHC's budget go towards partnerships with community health services? If so, how much and what specifically will this fund in FY22? The Recovery Services Bureau and the Homeless Services Bureau have two of the highest proportions of externally funded FTEs compared to internally funded FTEs within the BPHC. Why are such a large portion of positions externally funded for homelessness and recovery services? And does the commission plan to change any of these positions to internally funded? Then Office of Health and Human Services, Councilor Arroyo asks, can HHS explain and give a little context for the new $1.75 million investment for alternative policing planning? Who will HHS be partnering with, if anyone? When does HHS expect the alternative policing model to be ready? When can we expect implementation? What will the rollout look like? HHS is expecting $4.175 million in contracted services for FY22. Can they explain what specifically the office will be contracting out for? What will the breakdown of these contracts be across HHS, the Office of Food Access, and OPS? Then HHS has no minority business enterprises, women business enterprises, or small locally owned business enterprises who they're contracting with. How is the office working to change this, especially with $4.175 million in new contracts expected? Then for the Boston Transportation Department, Councilor Arroyo asks, why is the Go Boston 2030 tracking and communication grant being zeroed out in FY22? Was this a one-time grant? What is the status of Boston's neighborhood slow streets program? Is there still a backlog? And if so, how long a backlog? And when can we expect to catch up? For BTD's targeted traffic calming measures, how is the city determining which streets get priority in getting these measures installed? Can BTD explain a bit more about the $2 million increase in contracted services for FY22? And then 90% of BTD's top earners are white. How is BTD ensuring that its employees of color are not being locked out of higher level positions within the department? Similarly, 80% of top earners are male. What measures is BTD taking to ensure that women are not being locked out of higher level positions? Then for Public Works Department, how is Public Works working to reduce the disparity between the number of female and male employees? The breakdowns for this year are almost identical to those from last year. What has PWD done over the past year to try to recruit and hire more female employees? So those are Councilor Arroyo's questions. I am grateful for, I think that's everything. Yes, those are all of the questions that we got from councilors, and we will be, per usual, putting this together into a formal information request to go over to the various departments so that we can have the best hearings possible. So thank you. Thank you, everybody watching. With that, this working session of the Boston City Council's Ways and Means Committee is adjourned. Thank you all.
Hi, Counselor.
Thanks, Cora.